Assalamu alaikum. From now onward, we will start our parasitology, and today we will discuss about Ascaris lumbricoides. What is basically Ascaris lumbricoides? It is the largest intestinal parasite found in human. It basically inhabits human small intestine and causes the disease known as Ascariasis. It is a soil transmitted infection, and it is the most commonly found in children, young children, school and preschool children. Now, let's talk about its shape. It is round and cylindrical, as you can see in this picture, and it has tapering at both ends. You can see the taper at both ends. Okay, color is pink or creamy, and mouth is provided with three lips. As you can see in this picture, there is a dorsal lip, ventral lip. Okay, so there are two ventral lips and one dorsal lip. Sex is separate in this parasite. Males and females are males are smaller than female worms. Male is curved at the posterior end. As you can see in this picture, male is curved at the posterior end. So the first upper one is the male nematode and the lower one is the female. How it is transmitted? Its transmission basically occurs mainly by the ingestion of contaminated food or water that is already contaminated with its eggs. Occasionally, it can also be transmitted by the inhalation of contaminated dust with eggs. And children playing in contaminated soil may acquire the parasite from their hands. Okay, now we will discuss a little bit about its um, life cycle. So, adult unfertilized eggs will not undergo any development, whereas fertilized egg will are the infective one. So it will embryonated egg with larva, as you can see in this picture, and ingestion of embryonated eggs. What will happen? Hatched larvae enter the circulation and migrate to lungs. Then, after this, the larvae are cuffed up and swallowed and re-enter the GH tract and maturation process in the small intestine. I will make you clear in the next picture what is the basic life cycle. First of all, infective eggs will be swallowed by food, contaminated food, and then eggs will reach the small intestine. And in small intestine, the eggs hatch, larvae then migrate to the hepatic portal to intestinal wall. After that, larvae enter lungs and alveolar spaces, causing cough. What will happen? The cuff up larva is again swallowed, and then larva will reach the small intestine for the second time. It mature in the small intestine, and adult forms lay eggs. After this, eggs are passed in feces, and embryonate become infective in a few weeks. Okay, this is the basic life cycle of Ascaris species. What is a pathogenesis? There are two phases of pathogenesis in Ascariasis. One is the blood-lung migration phase of the larvae, and during the migration through the lungs, the larva may cause a pneumonia. The symptoms of pneumonia are low fever, cough, blood-tinged sputum, asthma. Large number of forms may give rise to allergic symptoms. So first symptoms will be the blood-lung migration phase, and during this phase, the larva will show some symptoms, and these symptoms are pneumonia related. They could be fever, cough, sputum with blood, asthma, and large number of forms may give rise to allergic symptoms. Eosinophilia may be present, and these clinical manifestations also called as Loeffler syndrome. And in the second phase of pathogenesis, that is the intestinal phase of the adult, there will be no symptoms, only abdominal pain or intermittent colic, especially in children. A heavy warm burden can result in malnutrition. Wandering adults may block the appendiceal lumen or the common bile duct, and even perforate the intestinal wall, which can cause some complications. Okay, now what will be the complication of ascariasis? There could be some intestinal obstructions. Ascariasis can cause appendicitis. You are all familiar with the appendicitis. That is the inflammation in appendix. There could be the biliary ascariasis, perforation of the intestine, and cholecystitis and pancreatitis and peritonitis. These all are the complications of ascariasis. Now we will talk about a little bit about the clinical symptoms of Ascaris lumbricoides. In lung phase, it can cause hemorrhagic inflammation and bacterial infection. Symptoms will be bloody symptom, sputum, cough, wheezing, and fever. Intestinal phase symptoms related to the number of the worms. If there are small number of the worms present in the body, then intestinal symptoms will be asymptomatic. If there are large number of the worms, then possible the worm in stool, vomit, nausea, and patient may feel malabsorption and abdominal pain. If untreated, there could be some complications, and that can cause intestinal obstruction and malnutrition. So this is a little bit overview of what we have studied so far. Ascariasis is a parasitic infection that is caused by a roundworm that is known as Ascaris lumbricoides. So ascariasis is a parasitic infection caused by a roundworm known as Ascaris lumbricoides. Ascariasis is caused by the ingestion of contaminated food with eggs. Eggs live in soil and contaminated by feces. Most prevalent in warm, moist climate. These are mostly present in warm, moist climate. Children are most commonly infected by this parasite. Fingers or hands with contaminated dirt are put in the mouth. Risk factors: fruits and vegetables not properly cooked, washed, or peeled. These are the risk factors of Ascaris, and it is a round worm, tapered at both ends. Okay. Now let's talk about the lab diagnosis of ascariasis. Microscopic examination will show some of the adults that pass in stool or pass from the mouth or nose. In larval form, we will detect the larva in sputum. We can also do the stool microscopy. Eggs may be identified on direct stool examination, and there will be eosinophilia, particularly during larval migration through the lungs. So this is the lab diagnosis of ascariasis. Very easy topic, and I hope you all must have understand it. Thank you so much.